Okay, I believe we're ready. Welcome everybody to our third Courageous Conversation, Interfaith discussion. These are a series of weekly discussions that we're having on Friday afternoons at 3 o'clock. We have with us Kelly Small Casler, an RN, and she is a longtime friend of our executive director for South Coast Interfaith Council, Milia. And so in a few moments, she's going to introduce Kelly to us all. I was amazed to discover just over the last week that we all grew up within about an hour and a half from each other in the Midwest and Missouri. So it's amazing, small world that we're here together, and we're looking forward to hearing from you, Kelly. The theme for this afternoon is the call to serve, insights from the front line. And Kelly Small Casler, who was volunteering in New York hospitals, she was caring for critical COVID positive patients. She's going to share with us a little bit about her experience and background and some of her experience within those 10 days of serving as a volunteer in New York City. I'm going to introduce Marietta, who's our facilitator of the technology side of things, and she is going to share with us kind of our covenant and our general rules for our Zoom meetings. So Marietta.
Okay, just a few little things to help the meeting go more smoothly. I have everyone on mute. You can unmute yourselves at any time, but we're hoping that we will all be respectful and let the speaker be the one to speak. However, you're welcome to find the chat button down near the bottom and chat some questions either to Reverend Jonas or to Melia. And if your video doesn't have a good light on you, then you'll turn out a little too dark. So take a look and see how you present. We are recording now. And if you have any suggestions or questions about the technical side, you can chat to me. And be patient because this is something relatively new for us. But thank you all for participating.
Thank you very much, Marietta. And I think everybody can also, if you prefer the gallery screen, you can allow that. Or you can also accept speaker view. And so I believe on the top right, you have that ability to select the kind of screen that you want. And so Milia is going to share about Kelly Small Casler because you guys are longtime friends. So Milia, would you share a little bit about Kelly for us this afternoon?
Of course. Good afternoon, everyone. Thank you all for joining us. And thank you so much, Kelly. Oh my gosh, look at this. Yesterday we were talking on the phone and I was like, Kelly, I think it's been like 20 years since we've seen each other. And she goes, no, I was at your wedding. Remember? I was like, oh, I don't even remember my wedding. I mean, it's one of those experiences where it was like insanity. So it's true, you were there. But I'm so grateful and I'm so honored to have Kelly with us. And she's an incredible young woman, and more so than she thinks she is. And I know that even from just her our childhood together. But just a little bio on her. Kelly, she's been a family nurse practitioner since 2006, working in both urban and rural family practice. She's also been teaching nurse practitioner students since 2011. She actually finished her doctorate of nursing practice in December 2018 through the University of Kansas School of Nursing and completed her BSN and MS in nursing at the University of Missouri-Columbia. And when I went online and I saw her bio, she had like a line of letters next to it. So I was like, clearly this is a girl that has done a lot in this last 20 years or not. But what's really, aside from just her academics, what I find really interesting about Kelly is that she actually started her nursing career right before 9/11, right before the attacks in the Twin Towers in New York. And she was telling us that when that happened, she remembered, saying to us, she remembered two nursing colleagues of hers going to New York City to help out with burn patients. And at that time, at that time, she thought to herself, that's so amazing. When I have more experience, I want to do something like that, right? So that after that, it actually led her to various medical mission trips to Honduras, to Jamaica, And then she has been a counselor at the Missouri Children's Burn Camp, and she has been now a registered nurse for 19 years. And during that time, she's worked in trauma and burn intensive units at the University of Missouri hospitals. So working in the trauma unit, she ended up registering with what's called a disaster response team, where they're looking for nurses to come and help in various disasters. And so she thought, hey, of course, I would love to do that as well. So she registered for that, and she was called to be a volunteer in New York. And then when she saw that opportunity, she said, absolutely, I'll do it. And so she was there for 10 days, and she kind of jotted her journey on Facebook, and that's where I encountered it. And I was like, I would love to talk to her about this. So that's how we found Kelly, and that's what she's been doing. And so I'm so happy and just welcome you with open hearts and open arms to this session today. So yeah, that's kind of Kelly in a nutshell.
Thank you very much, Milia. So this discussion is about 45 minutes in length. We're about 10 minutes in right now. And so I'm going to ask a few questions to get us started. And then there will be a time of Q&A where you can ask questions. You can send through the chat box a question to me or to Milia, or you can raise your hand by selecting that icon close to the participants tab on the low kind of menu bar there on the screen. So the first question that I'd like to ask you is, I'm just imagining that experience of residing in Ohio and then going to volunteer in a place that's totally different, like New York City, volunteer work where you're working with critical COVID-19 patients. I wonder if you could kind of paint a picture for us and describe for us your arrival on your first day working as a volunteer RN in New York City. Just kind of paint a picture in our minds of what it would have been like to be you in that first day in the city.
Okay, well, thanks, Jonas, and I thank Milia for the opportunity. This is kind of really neat. I just love reaching out, kind of nationally, and with technology, we all feel so much more connected with each other. But yeah, that first day was pretty rough. I decided to drive. I'm only about 9 hours drive from New York City, and so I had, a 9-hour drive, and the GPS, I kind of got mixed up with the GPS, ended up on the wrong bridge, went over to Brooklyn instead of Manhattan. And then as I'm trying to find my way, back to where I needed to go, where I was supposed to go, I was like, what did I do this for? What am I doing? I think I was just exhausted from the drive. I was nervous. I was out of my comfort zone. And so, I started to tear up. I had also had no idea what hotel arrangements I was going to have until like a couple hours till I was outside of the city when they finally called me. So again, it just was all this kind of stress mounting. And as I'm finally pull over, figure out which way I need to go, and start getting back into Manhattan, I'm trying to fight back tears at least until I find the hotel. And at that time it was around the 7 o'clock, and I started hearing the distant sounds of people cheering for the healthcare workers. And so that was kind of really neat timing, because it kind of made me feel a little bit better, like there was a need for me to be here. There was a reason. And so I was able to find the hotel, get myself situated, and kind of rest up that night. And I was just looking forward to the first day, the next day going in, because once I got the details of what I would be doing, I felt like a lot of the anxiety and the stress would kind of dissipate, because once I just got busy doing, what is my work. So the next day I showed up at 8:30 to Bellevue Hospital, which was the hospital I was asked to serve at. This was a volunteer nursing through New York Health and Hospitals, which is their public hospital system, which had been hit pretty hard. And so I showed up at 8:30 with human resources. It had some orientation to some of their nursing protocols, and got fitted for the N95 mask, which is the special particulate mask. And what you may not know is that it may feel like it fits right, but they actually have to put you through some tests to make sure that you can't taste or smell certain scents through it. Otherwise, it's not blocking what it's supposed to block, and you could be exposed. So that, that testing took a little bit of time because there was people ahead of me. But that took, the morning, and then in the afternoon, they assigned me to a cardiac ICU, which doesn't have any cardiac patients anymore because it's all COVID. And I just, jumped in. I was kind of an extra set of hands for the nurses. The nursing administration team had decided, since I was there for a short time, that I would be most useful as just kind of a second pair of hands nurse. And so there were some days where there weren't enough nurses, and maybe nurses had an extra heavy assignment, extra patient or two. And so I was paired with them, and we would just, we would kind of just team up to do what needed to be done. And, after that first day of just getting in there and kind of just doing what is my craft, what is my, skills, I kind of forgot about all the anxieties and fears. And after that, there wasn't so much, hesitation and anxiety on my part of, oh, did I make, why did I do this? It was kind of clear to me that that I had made the right decision, and I felt good about helping.
Thank you so much.
Jonas, please forgive me. I'm so sorry. I'm going to interrupt you for a second because it was my forgetting. I would love to kind of connect this time. She was talking about kind of the support that she saw when she got there. She heard the cheering. She was at that time. And we actually have a little video that I asked Kelly to share with us of one day when she was walking out of the hospital, just to kind of give you guys a feel on what that is. And so maybe it and then you could see my conversation with Marietta as well. I was on another call. So can you guys hear it?
I can't hear it, Malia.
I can't either. Marietta, is the volume?
Hang on, you have to hear that. Hang on just a second. Let me try that again because that was amazing. Hang on. We're going to do this one more time without the mute button on. Here we go.
Oh no, it's crazy now. Yeah, it did make me cry too. It was pretty neat.
Wow.
And I don't, and Jonas, forgive me again. I'm going to interrupt one more time, and then you please continue. What I really found amazing is the noises you hear. It's not just the cheers. You certainly hear the people honking and cheering, but at the same time, you still hear like the ambulances, right? So it's this constant reminder of like, there's things that are going on continuously, and these frontline, healthcare official, workers. It's every day, all day long. It doesn't stop just because the shift changes at 7 and then, new people come in. So it was just, for me, it gave me goosebumps when I was listening to it. And when I
actually have to share, that was ambulance lined up on the road. In that particular area of New York, the fire trucks and a few ambulances lined up would play their sirens at the same time. And it was hard to see on the video, but you know, it was real meaningful to me because we had there was this line of New York city firemen, and Amelia, please feel free to share that with the group so they can see it without freezing up, because you can see them in the background clapping, but here, you know, here we have the frontline heroes from 9/11 response, you know, there for us. And I've told people I don't feel like a hero, but that for me, for people who I view as heroes, to be there, saying thank you was very meaningful to me, and I know to other people.
You know, I've got a question before I get to some of the other ones that that are kind of in a different frame of mind. But I wonder, and this isn't out of the kind of scripted questions that I sent you, so this is a different one. I wonder, was there something about the COVID-19 patients that kind of required something different of you than you've done in nursing before? I mean, what was it like specifically working with COVID-19 patients in terms of offering care? Was it pretty, I mean, you applied the same skills, but was there something kind of a learning edge there because it was kind of new territory and a different virus? How did that factor in?
Yeah, that's a great question. A couple thoughts come to mind. You know, working in the intensive care unit, so that's where I got my start as an RN, was in a trauma and burn intensive care unit before I went on and became a nurse practitioner. And, you know, with this volunteer opportunity, I went back to my roots as a registered nurse and worked in that capacity. And, you know, so intensive care nursing is always pretty labor intensive, but the COVID-19 patients are even more so, just because it does take a while to put on all the protective equipment appropriately before you enter the patient's room, and to make sure you put it on correctly. And then not only that, but when you're in the room, it gets so hot doing the patient cares in those that you just sweat, and you're dripping sweat, and you can't itch your mask, but it's itchy because the sweat is, you know, is dripping down your face and underneath the mask. And so it's a very you need a lot of stamina to care for these patients, you know, mentally, physically, emotionally draining. That wasn't terribly new to me, because after working for 7 years in a trauma unit, I had seen a lot of sad stuff, you know, young kids that passed from motor vehicle accidents, and, you know, they can be pretty sick initially when they come in, but the sheer number of patients at the same time that were sick was something that was new to me. There was just a lot of patients that they were busy all the time, meaning there was so much you had to do for them all the time. And you're just constantly changing in and out of the protective gear because you're coming out of the room to get something. I mean, we tried to group our cares together so we would only go in as little as possible, in and out as little as possible, but you are going in and out of rooms multiple times a day, changing in the gear, and you have to be very careful when you take it off so you don't contaminate yourself. And the masks were not made to be used more than for one patient encounter, so you had to be very intentional about not touching the mask, or if you wanted to take it off, you had to be very intentional and careful about taking it off and then not touching anywhere else. So that was probably the stamina needed to care for the patients, and then just the cautiousness of the what we call PPE, personal protective equipment.
My next question is, you know, I think about you know, this was a sacrifice that not only that you made, but your whole family. I mean, you've got a husband and you have 2 sons. Is that right?
Yep.
Um,
4 and
and
8.
you know, 10 days, especially during this period of time. I mean, that really is a family commitment. And so part of these discussions, we've been looking at the connection between faith and service. And so I'd like to ask you how your faith has motivated you to the call to serve in the capacity that you have, whether through your volunteer work or other work. Tell us about how your faith motivates that call.
Yeah, and I reflect on that a lot. I feel like my spiritual gift that God gave me is healing. And for anybody interested in my background, I grew up Disciples of Christ, but I've really kind of I follow non-denominational Christianity and have been to a variety of denominations. But I do very much believe in the spiritual gifts, and I feel like healing is my spiritual gift. I also, so it's always kind of been in my heart or in my mindset of it's kind of an innate thing. Like I always am empathetic to what other people are going through and how difficult that must be. And so I'm always wondering how I can help. I also know that like again, my roots starting as a trauma nurse and even just seeing, I work a lot with underserved populations and just seeing like there's nothing special about me that I should be blessed and have been as lucky in my life to have what I have. So just being able to give a little bit back of those blessings or share that love that I've felt from God is kind of how my faith motivates me. I have a lot of reactions from friends and coworkers. And of course my mom sent me this very this text of almost like, I think she was trying to ask me maybe not to go because she was scared for me, but she knew she knew me and she knew I had to go. And then my husband just knows me. And just, he knew that was just something I wanted to do. But I mean, to me, I didn't see it as a big sacrifice because these poor patients and their families are not able to see each other for 2 weeks or longer, much longer than I had to give up my family. And the nurses, I know that they are exhausted. There are some Navy nurses and Air Force nurses that are going out there for 4 months. So I just kind of felt like it was a very minor sacrifice that I could make to try and help put a small dent in other people's suffering or stress. And that's both from a patient standpoint and from the other healthcare staff that were just exhausted from the weeks before when everything first hit.
Thank you, Kelly. I think a lot of the questions, and I hear this a lot as a pastor from church members, talking with other nurses and, what questions I might be able to ask you. A question that has come up that I think would be interesting to hear your response is, a lot of people seem to be wanting to know more about self-care. And that's a really tough thing for a lot of people of faith. It can be really hard, I think, sometimes to kind of name what it is that you need and to acknowledge that. And I think folks sometimes are more comfortable giving than receiving, and receiving is incredibly important, but we all have to be in a place where we can receive grace or receive care. And so I wonder, when you were there in New York City and you're outside of your comfort zone and you're out of your element and you're working hard and you're wearing the mask and, sweating and all that. I mean, how do you take care of yourself spiritually and emotionally within that context? I'm interested to ask you both while you were there in those 10 days, but then also in your day-to-day life as you've come back to Ohio and back in your element. What's been your self-care? And I know that's kind of a personal question, but it's one that a lot of people are interested in.
Yeah, I think it's a very timely question, and it's not, I don't find it an intrusive question. I know some people might, and a lot of that is because right now working at Ohio State University, it's the College of Nursing where I teach, we are very much the leaders in wellness and self-care. And I very much tell my patients that maybe are caring for a loved one or a child with special needs or something like that, that a healthy mom, a healthy dad, a healthy grandma makes a healthy kids. It's the whole thing of, sorry, my cat decides he wants to join, it's that whole analogy of put the oxygen mask on yourself before, okay, Snowy, put the oxygen mask on yourself before you put it on somebody else. Let me get him out of the way. Sorry.
No, that always happens to me too. The cat. Go ahead.
Yeah. But so, initially when I was younger, I don't think I realized the importance of that concept, but it's definitely something that I continue to work on. And part of it is that the way that I'm built, the way that God built me, is that I honestly get a lot of reprieve from just being able to help people. That's just how I'm built. I hear that from a lot of healthcare providers, but there are times where I'm very in tune now, finally, with myself, where I realize I'm starting to hit the wall and having compassion fatigue. And in those times, I just have to modify my activities, and I might need to, so when I was in New York, being that I'm older, I wasn't than I was the last time I did bedside nursing. I wasn't sure, but I kind of just felt myself out. And after about 3 shifts in a row is when I started feeling drained and tired. And so I just took it the next day off to maybe sleep in, talk with family, walk around a little bit, just to do something where I was kind of recharging my batteries. And then at home, I do, deep breathing or just listening to music, or sometimes just sitting in absolute quiet is really nice. Because especially in the ICU, there's never silence. There's always some kind of beeping or binging going on. And so, a lot of times it's just meditating and, or maybe just like talking through something with God, like trying to understand, just trying to understand where I feel like I'm having a conversation, right? But I'm the only one that's like talking, but, it's just a variety of things, and kind of just knowing myself. I don't necessarily schedule things. I do try to walk or exercise at least like 30 minutes a day. A lot of that has to do with my physical health and the family history in my family of cardiovascular disease, and trying to prevent that. But I've also noticed in doing that it really helps with my mental wellness and my energy and my ability to handle stress too.
Excellent. Thank you, Kelly. All those are great things. I just have one more question, and then I do want to open it up to other questions that folks might have. As I wonder if this experience of 10 days in New York City, caring for COVID-19 patients, did you experience anything that you would say has led to maybe a different worldview or a different perspective perhaps a different perspective on healthcare, or maybe just a different perspective on life. It might be minor, it might be big. I don't know. Did you have a sense of any kind of a change that occurred as a result of that?
Yeah, I reflected quite a bit on that, and as somebody who's been in the nursing career for almost 20 years and also teaching future nurses and future nurse practitioners, I've kind of always lately reflected on the healthcare system. But I did kind of have just some poignant ideas on just ourselves as a society and culture in general. I just really hope that we can hold on to that togetherness and we're in this together feeling. I fear, just having lived and through history, that as this dissipates, we will forget our human kindness to one another, or will on one side, I'm really excited that as humans, we've come together and we can work together in crisis, but I get very frustrated that when we're not facing a crisis, we forget all that. And I wish I knew a way to motivate the entire world, society, to not forget that when we're not in crisis. From a healthcare perspective, it's definitely highlighted that we still have so much work to do with health disparities in our at-risk populations. I did happen to be in one of the public hospitals, and it just highlighted, it does seem to be hitting people of maybe social disadvantage or with social disparities a little bit harder. And I hate that. And that's something in my nursing career and my colleagues that we continue to instill in our students. But this situation did just heighten, the need for that we have to, kind of fight for those, to close those gaps on those disparities, especially too the sacrifices we've had to make with the stay-at-home orders have just hit. So I also care for outpatients as a nurse practitioner, and it's just hurt some of my at-risk populations a lot harder, than people that don't have those social disparities. And yeah, it's highlighted the need for teamwork and communication as a culture, as a society. It's also highlighted that we have to be really careful about not letting fear overtake us. There's been a lot of fear, and it's I think COVID is something that we have to be aware of. We have to be respectful of it, but we don't have to live in fear of it, right? Because I've seen both the outpatient side of things and inpatients, and I've seen several patients of mine that have recovered without needing the hospital. So, but I've seen a lot of fear from people in social media and just society. And so I think just, kind of facing our fears and helping each other through our anxieties and mental wellness, it's also highlighted that.
That's really powerful, Kelly. And I love that, what you said about not forgetting the kindnesses towards one another, not to forget certain things when we're not in crisis. And what that made me think of is, I think that's one of the reasons why I read sacred text, any authoritative text of any of our world religions, is because it's almost like saying, this is our collective memory, that we don't want to forget these stories or these narratives. And so it takes community, even across generations, I think, to be able to access those memories together as a world family. So anyway, thank you so much. Lots of really good stuff there. And I know I want to have some time for questions, and we're already, gosh, I mean, we really only have about 7 or 8 minutes here. So is there a question? Let me see. I don't know if in my chat box, I see James has a question.
Hi, James.
Hi, how are you? I'm a
Pretty
registered nurse. I'm a registered nurse in California, occupational nurse.
awesome.
I'm pretty much retired. I work 1 day a week at an essential company, and we're measuring everybody when they come through the gate, their temperatures and masks on and all of that. Were you tested for the virus?
Yeah, so I had the, okay, sorry, I'm gonna itch my nose even though we're not supposed to do that right now with COVID. I promise I'll wash my hands when I'm all done. Whew, I couldn't take it anymore. Yes, I was tested on the day before I left. I was tested and that test came back negative. I'll tell you, so something I teach in my nursing field or in my faculty work is I teach kind of the specifics and the basis and the imperfections of testing. So, you know, the tests that we have right now are not perfect. So it was somewhat reassuring that it was negative, but I'm still doing some modified. I have short interactions with my kids and until I know that I've had about a week and a half or 2 weeks of not being away from New York to say that I really don't think I caught it. But I feel really good, and every day I get more and more confident that I'm, that I didn't get it. So, and is it okay if I read out this other question that I had, Jonas?
Sure.
Amanda says, "Did you have to quarantine before or after?" So, before, no, because Ohio, if you saw in the news, the governor and our Department of Health director were pretty on the ball and pretty quick out of the gate to do kind of stay at home. And so we had some pretty low rates. The quarantine that I've been doing after is all on my own decision. No, the nobody tracked me, or like New York didn't report to Ohio that I came back from New York. And I think everybody's decision to quote quarantine, I think that's just it's an individual decision. Because every day we're learning something new. So I think it's kind of a decision, a personal decision that you kind of make. And like I said, I have short interactions with my kids. I go ahead and wear a mask. I remind them not to touch, my eyes. And then when we play outside or something, I try to stay 6 feet away from them while they ride their bikes or something. And then in a couple more days, I'm going to relax that because I'll feel more confident that I'm unlikely to be harboring it. And then Marietta asked, was there any one patient or experience that was particularly poignant that stays with you even now? And that's a great question, Marietta. I have a couple patients that stick out. Really overall, the experience that sticks out is that how scary it must be for people to be patients. And it just brings home why I love nursing so much, because we are the patient advocate. But here we are dressed up in this suit of garb, or PPE, and they're looking at us probably going, where the heck am I? And their family can't come in. But I do have one patient who we were able to get off the breathing machine, but he spoke Spanish, so there was really quite a language barrier there. I speak a little Spanish, but not enough to kind of help him understand what was going on. Really, it took me a little while to find somebody who could speak Spanish and explain to him what was going on, but just the relief after we were able to get somebody to explain to him what had happened and why he had been on the breathing tube and things like that. He kind of sticks with me just because he was quite anxious not having family there and things like that. And it was a positive, right? And a positive outcome. So, yeah. And I can show it. Let me see if this will let me share my screen. I wonder if if it'll let me. I'm trying to see if it has my.
I think I can make you a co-host and then maybe you can
Let
do
me,
that. Let me
there's
try
one.
that.
I can show this one picture that shows pretty good all the. Well, maybe I didn't get it. Oh, here, this is it. Pretty good. Let me see if I'll just try to share my screen. So hopefully you can see that picture there pretty good. That's what we look like to the patient when we're all dressed up and everything. That yellow gown and our mouth cut. This is what we look like before we go into the room. So I mean, I think that would be pretty scary if you were a patient that's already scared because you're on a breathing machine and you can't talk. And so yeah.
Are there any other questions from the body here? I think we're really at time at this point. So I think I'd like, Milia, would you do kind of a wrap up and say kind of a final word and also next week's theme? Oh, you're on mute.
I do that all the time.
Kelly, thank you so much. I mean, I think the work that you do and all the work that nurses do, although you guys yourself may not think of yourselves like this, which I think is a testament to who all of you are. When I say all of you, the people who are in the front lines. And I think it's because of that you're able to do what you do, because you disregard both the good and the bad, and you know what you need to do and you do it. And that's I was telling Kelly, she's so like easy about, oh yeah, just got a test and I'm just not gonna touch my kids. I might have it, but maybe not. And and for me, when I think about, okay, I need milk. I mean, it's like a day-long process of like, I gotta go to the grocery store today. I gotta get everything together. So it really is. You're inspirational. So thank you, Kelly. Thank you for all that you do and for all the frontline. And Jim, you're a nurse as well. And for those of us who might be here that are in this field, thank you for everything that you do. So we will be continuing this next week again. And I believe next week is you have the flyer, I think.
It's sacred practices during quarantine, challenges and opportunities. And you're one of the featured guests, Milia.
That's right. It's me and Jihad Turk, who is, he's an imam, and he's also the president of Bayan College University, which is based out of Claremont School of Theology. It was, and now it's their own entity. So next week will be a conversation about Ramadan. How do we practice Ramadan in quarantine? And then the subsequent week, I believe we have some others lined up as well. So so I hope that all of you guys join us next week, and just my thank you to Kelly again. And I'll give it back to you, Jonas.
Yeah, I would just say if you know that you'd like to RSVP for next week, send a note to the office. Cheryl's receiving requests. And if you've attended this, we may just, check in with you and say, would you like to, be a reoccurring participant? Because I know having to RSVP for each one a la carte takes some extra energy. So if you're interested in participating generally for the weekly discussions, you can include that in your notification and email. But that concludes our gathering this afternoon. So thank you so much again, Kelly, and to South Coast Interfaith Council. This is the sponsor of this program today. And we will look forward to seeing you next week. So have a wonderful weekend, everybody. And thank you for joining.
Thank you. Thank you.
Bye-bye.
Love you. Have a great evening.